35. So I'm going to go ahead and get us started. Really appreciate everybody being here today. We've got two great guests. One, Carol Price Guthrie, who is an old friend of a lot of us, I think, out there. She used to be an independent support coordinator and an independent support coordinator supervisor out there in our DIDD land. So we're glad to have her as a guest today. She's now with StationMD. And what is your title, Carol, with StationMD?
I'm Director of Program and Waiver Operations.
Okay, so excellent. Glad to have you here as a liaison with the folks at the central office. And then we also have with us today Milton Neuenschwander, who is Director of Enabling Technology. Is that correct, Milton? Something to that effect?
That is correct. Thank you for the introduction.
Okay, excellent. Glad to have both of you here. And we're going to get to your introductions here in a moment where we can find out those interesting facts. I do want to remind everybody to survey my backdrop here because I have made a change to my backdrop. Make sure that you can see everything there. And so if anybody wants to try and identify the difference in my backdrop, you will win an award. That award will be nothing but the bragging rights between now and next week for having identified that difference. Has anybody identified that difference yet? Has anybody been looking? Okay, the cup is missing. That's part of what has changed, but there's a little bit more to the change.
I'm trying to get my thing to
Sharon, yes, we're you might want to mute at this point. So, all right. Well, let me tell you a little bit about what's upcoming, though, before we get into everything today. So today we're talking to Carol Price Guthrie and Milton Neuenschwander about StationMD, very important program that we have here within the state. And then on May 24th, we've got our NAD national episode with Dr. Uzama Price. She's going to be talking to us about diversity and inclusion. On May 31st, we have somebody from the Tennessee Department of Corrections. Dr. Jim Casey is going to be here with us. And then on June 7th, we have one of our behavior analysts from the East Tennessee Regional Office, Mickey Tonis, who will be with us. And so we've got a great lineup upcoming, punctuated by today's presentation by Carol and Milton. So I'm going to do a quick Get Smarticle for you. And this is actually a brief article that I wrote actually a couple of years ago. Now that I look at it, it's about 3 years ago that I wrote this article. I'm going to see if I can share it here, if I can figure everything out. Share content. Yeah, there we go. All right, am I sharing?
Yes, sir.
All right. I'm just going to talk to you a little bit about StationMD, and my involvement with StationMD goes back to 2019 when I met Dr. Matt Kaufman, who has put this really great service together for people with intellectual and developmental disabilities that offers telehealth services 24/7. And so, this really became a huge ordeal during the COVID crisis, because there was a great need at that point to avoid going to emergency rooms, right? We didn't want to go to emergency rooms because that was a place that we were concerned that we might be prone to contract COVID-19. And so it really stimulated a lot of interest in telehealth. But I think for me, that interest in telehealth predated the COVID crisis. That kind of gave us a real excuse to really want to pursue that. But really, there are several good reasons that we should be thinking about telehealth at this juncture, and particularly the telehealth service that's offered by StationMD. So I make this statement: telehealth was great even before it was cool. I was playing a little bit there on that old Barbara Mandrell song. I was country before country was cool. Well, we liked telehealth before it was even cool. So that's one great thing about it. But one of the things that is offered by telehealth is rural access. So a lot of people who live in rural settings who may not have as much access to easy access to an ER or to a doctor who has a certain specialty or whatever, that can be provided through telehealth. And so rural access is one of the great reasons that we do that. Another great reason that we engage in telehealth is because of cost savings. So there is a tremendous cost savings associated with the StationMD service. One of those cost savings is that you don't have to travel places to get the services necessarily. That's certainly a cost savings. But there's also a cost savings to an agency that might use this, because what do you have to do if somebody has to go to the ER? A lot of times you have to call in another staff member to, take care and provide care for someone else while a staff member takes someone to the ER. There's an expense to that. Likewise, with the shortage of staff that we're dealing with at the current time, this is another big savings for an agency if they can prevent unnecessary emergency room calls. And, it is also, I think, healthcare resources that are at a premium right now. A lot of times, if you go to the ER, there's a long wait associated with that. And so this really helps, I think, fill in the gap as it relates to some of the resources that people may need. And I do know that StationMD is not only offering this emergency service that they offer, that Carol is going to talk more about shortly, but they also offer ongoing primary care for people and primary psychiatric care for people. So, and doing all of this through a telehealth platform. The telehealth options are expanding. So we're seeing a lot more telehealth out there. There are, HIPAA concerns that we have with this, but all of those have been addressed through StationMD and through other mediums that are used for telehealth. So I think we're beginning to, we're actually probably moving more toward the middle of implementation of these telehealth options. And we really need to get on with it so that we can ensure that people are getting these important services. Sometimes people do need an ER visit, and the good thing about StationMD is that they recognize those circumstances, and they will send people to the ER when the circumstances require that. What's also great about it, though, is that they will contact the doctor at the ER to explain the situation to them. We had one situation I'll just mention real briefly where a fellow was sent to the ER because of a problem with his leg, just put it very vaguely like that, and it was his right leg. Well, when he got to the ER, there was confusion. He wasn't able to communicate very well, and the ER was starting to examine his left leg. And because of the StationMD's intervention, they were able to steer them in the right direction and ensure that he got the treatment that he needed. So it is just a really unique and great service that they offer. It is something that is available, and we have Milton Neuenschwander here today to talk about how you can get this service through our Enabling Technology grant. So it is a very unique service offering services 24/7 to be able to address any kind of need that may come up. So that could be, for instance, somebody needing a prescription filled, like their meds have run out, they need a prescription refilled or re-prescribed. StationMD can do that. You don't need to go to an ER to get a prescription for a medication. Lots of things that don't rise to the level of requiring ER intervention, but that do create liability and create concern for persons supported, do need to be addressed. And so they're able to do that. I'm going to leave the rest here for Carol and Milton to talk about, but DIDD has been contracting with StationMD for, I guess, close to 2 years now, right around 2 years, to provide its service within our intermediate care facilities across the state-operated ICFs. It has been a great service. David, I think what's the diversion rate, the prevention of ER visits? We're somewhere above 85%. You're muted, David.
Sorry about that. Yeah, it's 90 to 91%. It certainly exceeds the predictions from StationMD and has been a great benefit.
Yeah, 91% of the calls that we get through and that we take through StationMD get diverted, prevent an ER visit essentially with 91% of those. So that's fantastic. So we're so glad to have Carol Price Guthrie, old friend of ours from the DIDD system, to be here with us today, and also Milton Nunschwander, who's been on this program several times himself. He may be getting close to being a five-timer, for which we also give an award, Milton, by the way, but it's also nothing. It's just a figurative green jacket. So even if you achieve that, it won't be much, but it'd be something you can brag about. By the way, did anybody get the right answer on what was different about my backdrop? Well, I'm going to go ahead and give it to you. I'm going to go ahead and give it to you. It's this book. This is a book by Colin Powell. It's his autobiography, as a matter of fact. Colin Powell is one of my favorite people. And he had a lot of great tips in here about leadership. That's one of the things I really loved about it. But one of the things he said was, I was talking about this beforehand, is that if you have a meeting, you should probably try to end that meeting within an hour. Don't go on and meet for forever and ever about things. And then Carol and I were speculating, well, sometimes 30 minutes is good. Sometimes 15 minutes is even good. But this was a principle I learned from Colin Powell. Another thing I learned, though, there's a really great thing. He said, there's no telling what you can accomplish if you don't care who gets the credit. That was one of the things I really loved about what he said. One of the things I've carried with me from this really great book he wrote about his life several years ago. So I'm proud to have that book of Colin Powell. And I hope that people might go out and pick that book up. I think you really enjoy reading it. So with that, we're going to move to introduce our guests for today, though. I've talked about them already, but I'm going to let them introduce themselves some, tell a little bit about themselves. And we'll start with Carol. So Carol, you want to tell us a little bit about yourself, and don't forget to tell us that interesting fact.
Okay, I sure will. And thanks for that, Dr. Davis. And good afternoon, every single one of you. It's really, really good to be here in this space, to see some old faces. And I hope to make some new friends along the way. As I was talking earlier before you got on the call, I was telling the folks who are on that I'm from Greenville, Tennessee, and I saw some of my classmates on. So again, shout out to Greene County. Um, I have been in the IDD field since I was 16 years old, believe it or not. I started out at the Holston Home Bewley Center as a 16-year-old, and this is what I've done my entire career. I've always lived in Tennessee. I'm a graduate of Tennessee Tech University, and I'm also a graduate of Walden University. And this is always what I've done. As Dr. Davis said, I've been a support coordinator, manager, owner of the company. I've been a provider. I've been in the provider world years ago, back at Old Sertoma Center in Knoxville. I was there. And MCO. I came to StationMD from an MCO. And so I've had a gamut of experience. And I'm always excited when I can come and talk to my peers and my cohorts about something I feel adds value to the lives of people we support with IDD. I love working in this field. I'm an advocate for those who have IDD and for those who support them. And so I would never stand before you about anything that I didn't feel was a value add. But with that being said, something about myself that probably you don't know is that I'm a trained classical musician. So I'm a vocalist. I've traveled all over Europe singing classical music. In my older age, I've gotten a little bit lazy, but I'm sure that's something you probably, maybe the people from Greenville might know, but other than that, I'm sure you don't. So that's my secret.
I did not know that,
I
and
know.
I'm so glad to learn that. And, you know, I'm always tempted every time somebody brings up something like that to ask them to give us a sample of
Yeah, I hear
their
that all the
skills.
time.
But
Maybe
I
next
won't
time.
press you to do that today unless you want to. But that's very interesting. So you've traveled throughout Europe doing that. Wow, that is impressive. What are some of the things that you sing? I mean,
Arias is what I
okay,
sing. I'm a first soprano, and so the music that I would sing and perform are arias. In my later years, I changed to gospel, so all I do is gospel now.
wow.
Hmm.
Well, that's great. If you ever do feel that you want to give us a little sample of that, we will welcome that. So,
Thank you so much,
yeah, I
Dr. Davis.
appreciate that. And Milton,
Yes, so I'll go ahead and introduce myself. Um, my name is Milton Newenswonder, and I work for the state of Tennessee DIDD as the Enabling Technology Director. And I've actually been in this director's position for 2 or 3 years now, but I started with the Enabling Technology Program as a tech champion when it first started as a pilot project about 4 years ago. So I've been with this enabling technology program from almost the very beginning, and it has been a labor of love. And we've been working with all the departments, trying to see how technology can help impact the lives of the people that we serve, and helping them become independent and meeting all their health needs wherever we could with using technology and supporting them within their services. So. Um, I've actually been with DIDD for just a little over 5 years now. I'm going on to my 6th year. And I started out in staff development and person-centered facilitation, and I had a wonderful supervisor of Marie Hahn, so I thank her so much for getting me up and going with the IDD. And now I'm trying to take those skills that I built as a staff development and person-centered facilitator and apply them to what we're doing with the Enabling Technology Program, and it feels really good what we're doing and very rewarding. So as far as a interesting fact, actually was born and raised in Indiana. I went to college at Wabash College and majored in religion, minored in chemistry, and was a pre-med area of interest until my senior year. So I also played college baseball for all 4 years as a relief pitcher. So um, really enjoyed my college years and love education and training.
you were a pitcher.
Yes.
Wow, that is impressive. I'm a huge baseball fan, by the way. I don't know if you've noticed, you can't really see, but I've got some bobbleheads back here behind me. I'm
Yes.
a huge Braves fan. So that is something very interesting to find out about you. So, and that was at Wabash College.
Wabash College. Yep, in Indiana.
Congratulations on that career there. And, you know, I don't know if religion and chemistry are, we always think of those as preparation for this work, but you do a great job. So it must have been pretty good.
Yeah. In my life, I just wanted to help people, and that's why I was thinking of becoming a doctor. And then I found a new career in helping people with disabilities, and found a new path. So I'm kind of still helping people in many different ways. Just didn't go the doctorate route.
Yeah, well, that's great. So thank you for being here. Thank you both for being here. And with that, Carol, are you going to start us out?
I sure can. And what I'm going to do is share my screen. I'm going to turn my video off so I don't have any problems with the PowerPoint, but I'll get right back on as soon as I'm finished. And just want to say to you guys, I've been with StationMD since March, so I know how we can be. So you all be easy on me. So I'm going to go ahead and start.
We're very friendly to our presenters, Carol.
Yeah, I know. Let me share my screen.
By the way, while you're sharing, I will mention David Taylor, DIDD's Director of Nursing, is my co-host today. So glad to have David on here. And of course, we have our producer, Babs Tierno. down, well, on my screen at least, she's in the picture below mine. So glad to have both of them here today, and hopefully if they have anything, they will come into this discussion as well.
All right. Can you see my screen?
Yes, ma'am.
All right. So when I started talking earlier, I was so excited to start talking about StationMD that I think I started talking about it just a little bit on the front end. But I just want to share with you just briefly about who we are and what we do. And Dr. Davis did an amazing overview, so I feel like I don't really have a lot left to say. But if you have
I'm sure
questions,
you'll be able to expand on what I put
I'm
out
sure I
there.
will. So if you have questions, please put them in the chat, and we can get to those. If it's something I can't answer, then I'll find out the answer and I'll get it back to Dr. Davis and David so that they can share with all of you. So again, thank you all for having me here today. So StationMD, we are a telehealth solution for people with IDD and also for people who are of other high-risk populations. And StationMD was founded by 4 board-certified emergency medicine physicians. And what they were seeing in their work is that people were coming through the ER with IDD. They were coming in for fairly benign reasons like minor falls or colds or symptoms that were just very minor. And they felt that there had to be a better way to treat this population that were coming into the ED. And so they formed StationMD. But also, what's neat to note is that each of the founding doctors had close family members with IDD, so they were intimately aware of the need for more specialized care for our folks. So, one of the first things they did when they formed StationMD was to develop a training program for our physicians. And this was training specific to people with IDD. And so the training was developed in conjunction with clinical advisors and advocacy groups, across the country. And so I wanted to talk just a little bit about the training that the ED doctors have, and then I'll talk more specifically about the IDD training. So with the ED,
Cheryl, I was just going to ask a question. This is one of the
sure.
things that really makes StationMD unique, though, right? Because
Yes, it does.
they there are a lot of telehealth services out there, but there are none others that I'm aware of that are specifically for people with intellectual and developmental disabilities and other disabilities. But uh, it is a service that is unique in that way.
That's exactly right. That's exactly right. And I appreciate you pointing that out. So yes,
Uh, and also noticed you got the screen shows Dr. Devin Unicott, who
I
was
know.
one of our previous guests on CCN. So I just thought I'd point that out to folks that he's featured here in your slide.
Well, I wasn't going to point out Dr. Devin, but since you did, I will. So on both screens, the doctor that's seeing the person is one of our founding doctors, Dr. Devin Unikdak. So very, very, very great doctor. Thanks for
Yeah,
pointing
yeah.
that out.
Mm-hmm.
So with the emergency department training, it's just important to note that they are in a residency-based curriculum for 3 to 4 years. Then they're board certified with core principles in emergency medicines. They're proficient in core emergencies, and they're familiar with disciplines like OBGYN, pediatrics, ICU, surgery. So they have a plethora of training just by being ER doctors. Our doctors treat people with all ages, so you might see them with pediatrics or geriatrics. That's very important to note. And they're trained, and this was very important too, they're trained to deal with the most emergent issues. So this will help them determine when to keep a person at home versus when to send a person out to the ER. So they're very skilled in that area. So specifically to IDD, there are several elements. So they are required to complete, and pass a course by Intellectability, which is a video program of several areas. and they're required to complete and pass testing with this. And it's by Dr. Craig Escude, who is a specialist in the field of IDD. They're also required to take a course out of the University of California in San Francisco by Clarissa Creepy, who is also a specialist in IDD. The doctors are also required to complete independent readings related to IDD. They're also required to complete monthly video lectures that are created by our internal medical team. And they are also trained in behavioral de-escalation technique. So it's very important to note that our doctors are specifically trained in these areas. And what I also like to point out is that on staff, they have SMEs, including myself, that are they're collectively more than 30 years with IDD experience. So it's important to know that their support team, in addition to the doctor's training, is skilled in IDD.
Yeah, so they've really built the infrastructure around IDD a lot more than even in the beginning, which was substantially more than anything I had seen before. But now it seems as if there's been a lot of sharpening of the saw and additional training that the doctors are getting.
You're exactly right, and we are very proud of that, and we are eager to share that with everyone. And so we, like I said, we do have other people on staff who are trained with IDD. So yes, we feel like we are um, building and going as we're learning and doing better and better. We want to be the best we can be. So we know that the challenge with our folks is that they're disproportionately going to the hospitals. They're going to the hospitals more than anyone else. And so what happens is that we're dealing with risk factors such as comorbidities, such as seizures or cerebral palsy or anxiety disorders, autism, things that we see with our folks. And what we don't see when we have people with providers, excuse me, is lack of access to medical care. But there are people who don't have services with IDD who do experience this, that if they don't go to the ER, that they won't have medical care otherwise. And I'm going to move this screen out of the way. There we go. And so we know with IDD and our experience in the system is that people are sent to the ER because of regulatory requirements. So if a person bumps their head or if something happens, if the PCP isn't available, then we send them out to the ER, whether it's necessary or not. So we see that happen quite a bit.
Those are the ones I hate the most.
Yes, sir. And I
Are
think we all
visits,
hate them. Yeah.
yes. The visits you have to make just to meet a requirement, that is bad. I mean, if you wouldn't have otherwise gone except to meet that requirement, I think those are terrible situations. One that certainly StationMD can give us a lot of comfort with.
Absolutely. Absolutely. And then we know that the primary care physician works on a schedule. And so oftentimes they can't see our folks. And so that would be another reason that a person would be sent out to the ER unnecessarily. So the problem with the ER, and I'm going to keep moving this around, sorry. The problem with the ER is we know that our folks experience patient trauma. So if they're having to move around or leave their homes or be transported, for some of our people we support, it could present as trauma. There is exposure to infection. And we know with the COVID-19 pandemic, that was a big, big concern. And it still is.
COVID's still with us,
Yes,
plus
it
the
is.
flu, plus everything else you can get at the ER. So
Yes, sir.
regardless of COVID, it's still bad. Yeah.
It's still bad. So we know that that exists. Also, we talked about a little bit before is that the care that they receive is not specialized. And so what we see happen is that they receive suboptimal care at the ER, which is a big, big concern. So we also have to talk in terms of costs And we know that when they go to the ER, then there are excessive costs because of unnecessary testing, or even if people are hospitalized. So our goals at StationMD are to provide access to the best possible care with doctors that are trained to care for people with IDD. With StationMD, you'll have access to a doctor 24/7, and Dr. Davis talked about that. It's on weekends, holidays, there are no off times. Our doctors are on shift, so it's not like you're having to wait on an on-call doctor to call you back. So it's like they're at work, but they're in front of a computer screen. So it doesn't matter if it's midnight, doesn't matter if it's New Year's Eve, doesn't matter if it's in the morning, dinner time, there will always be a physician available to you. So we encourage people to call. They should never hesitate to call us with any question or concern. Even if it seems like it's a person who's more lethargic. So you might not consider it very important, but yes, it is. So if you see someone who's lethargic, or they aren't eating as much as they normally eat, or they're just not themselves, that could be the start of an infection. So that would very much be the reason to call Station MD.
And that might be something you wouldn't even go to the ER about, but you could check in with Station MD on and get some advice and maybe know that you need to go to the ER or that you don't under that circumstance.
Absolutely.
And it's such I think we think sometimes that maybe it's a little bit less personal because it's via the telehealth screen, but I wonder if we get that much personal care at an emergency room. There's an old saying, and David Taylor will remember this with me, I think, among emergency room staff, called Gomer, which is get out of my emergency room. They
Mhm.
don't want you in there. They can't handle all these folks, and so they're I think you get really more personal care through Station MD than you would actually get if you went to the emergency room.
You're absolutely right. And one of the things that the ER doctors have told us, Dr. Davis, is that they appreciate our presence, and that we are intervening.
Well, if I can just make a quick testimonial about that,
Sure,
because
please do.
we one of the things we're so impressed with Station MD about is the documentation and the swiftness with which we get documentation of a contact that really facilitates the further treatment that the person may need under those circumstances. And the coordination that they do with the ERs is such an important aspect of it when a person does need to go on and go to
And Dr. Davis, I just can't stress enough the value of having doctors experienced with taking care of individuals with intellectual and developmental disabilities. That is a huge, huge piece.
gosh,
Absolutely.
great
Absolutely. And not
translator.
and what drew me to Station MD was not just their experience, because experience is there and you can get it anywhere, but they have a passion for it. And when you have a passion, it makes you want to do things differently. And that is why I was so interested in Station MD. There are lots of telehealth companies, but their passion, um, from what I've seen so far, is unmatched. And so I just thought I would share that as well. So I was talking a little bit about if you see a person who is different than what is their norm. So if you wait maybe to see a PCP, maybe it's a Friday and you wait till a Monday, you've already missed some days in what could have been um, an infection or something that could have been managed days before. So if you call on day one, you'll have a much better chance of treating the person in the home than on day 3 or 4 when they're too sick and really may have to go to a higher level of care. So that intervention on the front end is extremely important. So by treating people at home, what Station MD is able to do is to reduce the ER urgent care transfers, because everybody doesn't go to the ER. Some people go to urgent care, and you're as at risk at urgent care as you are at the ER. And so it reduces it reduces staff exposure, because sometimes we might not think about that. So if the person is in the ER, typically they're there with staff, or a family member, and those people are exposed as well. So it does keep them from being exposed as well. And in addition, it provides a savings, and we know that in reducing the number of physical transfers, and we know how that can be with staff and with the time that the staff actually sits and spends in the ER. I don't know when the last time was that anybody sat in the ER, but it's long. So our most important goal is to help improve the lives of people with IDD and their caregivers. We know we hear a lot about caregivers, and coming to, from the MCO world, we focused a great deal on caregivers because if they're not well, then the person is not well. And so we take that into consideration in our work. And so what you really should think about StationMD as is an extension of the medical supports that are already in place. So nothing is too insignificant to reach out to StationMD. Any questions so far? Any comments?
Yeah, I will just remind folks if they have questions that they can post them up in the chat box down below here, and that we will get to those as we're able to. So this is, I think just really, really important information for people to understand about StationMD is that it's typically, this service that you're talking about now, although StationMD does offer primary uh, services for people, you're talking here about the emergency telehealth service that they offer, which is an extension of the primary care that the person already receives from their doctor.
It is.
Yeah.
It is. It absolutely is. So I wanted to talk to you a little bit about the expense, and just to go quickly over the PowerPoint about what a typical process without StationMD talks about. And I've gone over that just a little, but I just wanted to show you with the arrows. So there's a medical concern. The staff or the family member calls a doctor or whoever is on call. Typically, either they're transported to the ER, or an urgent care, or 911 is called, and they get to the ER. And we talked about the over testing and the over treatment. And oftentimes, what is experienced is a hospitalization that could have been avoided. And then times that there are hospital complications if a person is there, which prolongs their stay. And what StationMD does is interrupts this process. And we feel like our services are person-centered. We want to know about the person. With the addition of the SMEs, we know that we need to look at those ISPs and those PCSPs to know who they are, to know about them before we prescribe any care. And so these are the things that we continue to fine tune with StationMD and that we have our focus on. And like I said, we want to do this with the best medical care that is person-centered, but with less expense and less trauma to the person and the family.
For testing and over treatment, but also the sitting around in an ER waiting to be treated is just, an enormous burden, I think, on particularly a lot of people with intellectual development.
Absolutely. And Dr. Davis, I don't know if it's me, if my thing is wonky, but I can just barely hear you sometimes. It might be me. Are you all hearing me okay? Okay.
We're hearing you great.
Oh, I can hear you
I'll try
great
to make
now.
an adjustment.
It's
Okay, maybe I
perfect.
just need to get closer to my mic or something.
Okay, thank you. So what is our impact on stakeholders? And we know that anytime we operate in this system, that there are shared benefits. So it benefits us all, for the people we love to support and serve to have better medical care, improved outcomes, and improved satisfaction. And this includes our person we're supporting, families, providers, payers, and the doctors. And we know that, and we take that seriously. So here are some common reasons that people would call into StationMD, and I'm going to continue to move this little thing around. Seizures, you might not think about that. UTIs, and you all can read them, and I'm not going to read them all, but I just wanted to prompt your thinking with some of them. Falls, that we know that we often go to the ER for when people fall. fever. Now, other things that we see in providers are med refills or a missed dose where you might have to find the doctor or the psychiatrist to help you with those things. StationMD can be used for those. Even if you have a question about a medication. Return to work. We know some of our folks work or school, notes. And we talked about before a changing condition, a behavior, a routine where they sleep more than normal, those kinds of things. And just general questions. If you have a question, you need to know something, call StationMD. And like I said before, they're 24/7. The calls are unlimited. You can call 15 times a day and you're still going to get a doctor to talk to and to consult with you. And so to me, that's an amazing thing. And I know back in my provider days, I sure could have used it.
Yeah, it really is remarkable that you have access to have that medical question answered at
Yes.
any given point in time. I mean, that's pretty remarkable.
Yes, and I want to stress so much that these are doctors. They're not PAs. They are doctors. They're not RNs. These are people that these are doctors, all trained in IDD. And I just wanted to tell you that StationMD has been able, and we talked about these statistics a little bit earlier, but to treat people in place overall, I think you all might have spoken to Tennessee statistics, but I'm speaking nationwide, about 93% of the time. And so we're very proud of that. And it's been consistent for the past several years. And it's not affected by a person's living environment, not where they live. It's not affected by their living environment. We haven't seen any difference in how people are treated in place based on where they live, is what I'm trying to say. And this is a slide that just talks about the StationMD process, a change in condition. So we're talking about, and I'll go through it fairly quickly. If you want to stop me, please do. A 24-year-old female with cerebral palsy, asthma, and they figure out she's just not acting right. And how many times have we seen that to where we say, you know what, Sally's just not acting right. You can't put your finger on it. She's drowsy. The family says they're worried because they haven't seen this. And so what happens is the provider initiates a call with StationMD, and you can see that we're activating StationMD. And with our onboarding, when you activate StationMD, they do like an onboarding process. And so what they'll do is, I'll just leave it there. They'll gather your information, like your consents, your PCP contact, all that information they need on the front end to do a thorough assessment. Sorry, my slide's not changing. Give me a second.
So they're not going to be making decisions in the blind. They've got all the information that they need to know your history, and that they can also make a coordinated contact with the primary care physician as well.
Exactly. And if they need to, they will. So forgive my slides. I'm trying to move the screen and it's moving my slides, so forgive me. But so what happens is you get to a physician assessment. They gather the information, the physician makes the assessment, and they noted for this particular person that she'd been taking Benadryl. And so what seems to have been a big deal, it could have been a big deal if they had gone to the ER. So it was thwarted by talking with StationMD. And so what they did was had them hold the Benadryl. And then the StationMD doctor followed up to the exam, and they checked back in 3 hours. The person was awake and doing much better. And so, like we said, we were able to avoid ER contact. However, I do want to say, and like Dr. Davis said a little bit earlier, that if there is a need that the person go to the ER, then StationMD would have staff, family, or whomever follow 911 protocols as with any emergency. And
Yeah,
so they,
truthfully,
yeah, go
what
ahead.
StationMD was able to do, it seems like to me, Carol, was identify that we just had a ton of ER visits that really weren't necessary, and it was pretty much low-hanging fruit. We can
Yes,
divert 93% of these ER visits just by offering this service.
absolutely. Absolutely. And
We've
that
had
is the
two
goal.
questions come in. Do you want to take those now or do you want
Yeah,
me to hold
let's
them?
take them now.
Okay, one is, do they work with mental health crises such as self-injurious behavior resulting in a wound?
So one of the they are trained and will deal with with crisis intervention. And so one thing that I would suggest is if you want to use Station MD and you know a person has these issues, I would set up a pre-meeting so that the doctors could read the plans and understand those things and pull some of us in to assist with that before you just call in blind with a crisis like that. But yes.
Okay. And then the other question probably will lead into Milton, but do they work with someone on all the waivers, ECF choices, main waiver, Katie Beckett, etc.?
Milton, do you want to answer? The only one I can't say yes to is Katie Beckett, but Milton, maybe you can answer.
So yes, so right now we have enabling technology funding to help with getting the technology and the software and the subscription necessary for using StationMD for ECF choices, the choices program, and 1915C waiver program. Um, with Katie Beckett, they also have a assistive technology / enabling technology fund for it. Now they go through a different process for making sure that some of that Katie Beckett money is allocated towards that assistive enabling technology service. So if somebody is interested in StationMD as being part of that Katie Beckett service, then they should talk to their Katie Beckett case manager at the beginning of their annual service intake and see if if they can provide some funding, uh, allocate some funding for that part of that service. So so Katie Beckett does have a little bit different process for requesting those assistive and enabling technology services.
Thanks, Milton. Any more questions before we
That's
go
it
on?
for now, so we can keep going.
Okay, thanks.
Let me just real quickly, Michelle Bagby made a comment down here about crisis prevention and response, considering a referral to 10-star assessment stabilization teams. And one of the things that I think can work well too is a collaboration between StationMD and the START teams that we have, because they create a crisis plan which could be provided to StationMD where they might participate in the crisis de-escalation, that they would be a partner in that. So,
Absolutely.
you know, I think this is a great area for potential collaboration between these two systems.
Absolutely. And thank you for that, Michelle. You're exactly right. And Dr. Davis, yes, indeed. I've had that right on my notebook to reach out to you about. So yes, sir, you're exactly right. Thank you. Great
Joan,
questions, you all.
Joan Jenkins asked, can anyone with IDD access services from Station MD and are referrals required?
Yes, referrals are required, and yes, anyone can access, but then it determines you have to establish a payer source. And so, yes, the referral, and that would be through Milton and his team, but we could certainly figure it out. We have people in other states who are not a part of a program who do receive services through Station MD. So yes, fantastic question.
You wouldn't require a referral from a primary care to utilize StationMD. Certainly, you could communicate that with the PCP that you do utilize it, but it's not a required referral per se with, like, insurance.
Oh no, no.
So again, this is probably something I can answer. So the referral that she was talking about is a referral to our enabling technology program, so that we know that people are interested in having StationMD as part of their current waiver services. And that referral is just basically to give us notice that somebody wants to go through that process of funding StationMD and getting the technology equipment. So the biggest part that our enabling technology program does is provide that funding for the equipment required for that telehealth visit for StationMD. And then as far as all the other services, clinical services that StationMD does, they still work with your primary insurance agency to make sure all those are also still covered their service.
Thanks for talking about referrals and making that clear. Thanks, Milton.
May I
Any more
just ask a follow-up question? So then is StationMD more geared toward a population that might have to have more regular types of medical visits rather than being set up for someone who might end up having a medical visit, but it isn't something that's on a routine basis? So if there was someone who had, for example, a child on the spectrum, maybe they were not being seen by a doctor often, but something came up with that individual, whether a child or an adult, where they felt that they needed to have a visit and perhaps could not take them to their primary care physician and wanted to access StationMD. Is that something that could be done, or is this process one that, because of the enabling technology, it really would work better for someone that might have more frequent visits?
It absolutely is not set up that way. We could support either. The way that StationMD is set up is to be a wraparound service to your primary care. We have no intentions of taking over the place of your primary care doctor. And so for those who don't see the doctor frequently, this would be the perfect service for them to use. Did that answer your question?
Yeah, and Carol, I also wanted just to kind of reiterate what you were talking about, is that StationMD has actually been used for a multitude of different scenarios with people looking to better manage their health care. And so anybody within our services, it's all person-centered according to how they would like to use StationMD. And we've had actually a lot of people who are semi-independent living that, they just wanted to better manage how they're in touch with a health doctor to make sure that they are to the doctor whenever they need it. And so they use StationMD to get that assessment ahead of time so that they could understand when they actually need to go see a doctor, even though they don't see a doctor very often. The other thing is we have people with chronic conditions that they feel that StationMD could be a good wraparound service, that whenever they can't make it to the doctor or they have multiple visits and they feel that a StationMD visit could help with those multiple visits and ensuring the medical care, they can use this as like a wraparound service as well. So it's all person-centered, and it's all according to how the person wants to use this telehealth and StationMD as part of their health management plan within their services.
That's exactly right. There are no requirements on how many times you use StationMD.
And Carol, I'm correct. This is still funded on a per person per month basis.
It is.
So you'd be able to look at the cost of that over the course of a year, which is relatively inexpensive, and be able to say, well, the cost benefit analysis, essentially. I'm sure if people had one or two ER calls or potential ER visits per year, that they would certainly still benefit from this service.
Absolutely. In Tennessee, the cost is $30 per month per person. And so it very easily covers.
So it's $360 a year.
Exactly.
Of course, if we can get our systems to pay for the service, and a lot of people are in a system where they can get those services paid for, but even if you weren't getting it paid for, an agency, a family might see that $360 a year as a great way to address this need for emergency services.
All right.
So I think it even without funding, it would be an advantage, and we do have some funding available.
Exactly. And I would like to add that because our service is telehealth, the person would have to have equipment like a tablet or some means of accessing the doctors via telehealth. And so if you don't have those in the home, then you would have an additional initial cost of purchasing equipment or that kind of, that kind of thing. But after that, the
And,
$30 a month, yes.
And Carol,
and
just
Milton, yeah, jump
I know
in.
Milton's going to talk about that a little bit more.
yeah, I was just going to
I'm
add
getting
that
to,
that's all covered by enabling technology funding and benefit. So there's so that additional cost is still not an additional cost to the person themselves. So
right. I knew you were
Yeah.
coming to that, Milton.
yeah.
Thank you.
So
So, how can people access this?
yeah, so let me just jump in here because I know there's probably a lot of people's questions about how do they go about requesting StationMD and getting the technology and the service subscription that they need for this telehealth option. And so the first thing that people need to do is if they're interested, like we were saying, is that they can basically send in a referral form, and we have special referral forms for enabling technology program that as they fill it out, it's like a one pager. They can put the reason that they're interested in enabling technology is basically for StationMD, and that lets us know that to take them through that telehealth StationMD process. And so we also want you to make sure to contact your coordinator or your case manager and make sure that they understand that you guys are interested in a StationMD telehealth service so that they can also be a part of that discussion, and we'll take them through the process just like any other waiver service. And so whenever you're going through the waiver service, we want to make sure that the person themselves is interested in taking on this enabling technology funding and service to pay for StationMD, that they have some kind of reason or justification of how they're going to use StationMD to help manage their healthcare through their services, and that we include that justification in their individual support plans so that whenever we send all this information to plans review, then they have that justification in front of them and are able to make that approval to provide that funding to pay for StationMD and the technology needed for it. So basically, whenever that funding is requested, all we really need is that justification and a quote from StationMD of how much it's going to cost per month for that person whenever they're using it. And then we can base the cost of that service according to that quote. So a couple of things I just want to point out when using the enabling technology service funding is that whenever we use it right now through Appendix K, we're using the specialized medical equipment and assistive technology service code for this type of funding. It does count against a person's annual cost waiver limits. And so that's one thing to make sure is that whenever you're looking at that funding, that the person is still underneath their annual waiver cost cap limits. And that the other thing is this funding is available throughout when Appendix K is still valid, and we are still planning on providing StationMD and this enabling technology service even after Appendix K is done and the pandemic is through. So because we feel that this is so beneficial to have this telehealth service for everybody. So just to summarize, the best way to to get started with getting StationMD is just talk to your case manager or ISC coordinator or care coordinator, whoever it may be, and tell them that you're interested in StationMD, and then they will send a referral to our Enabling Technology Group email, which is didd.enabling.technology@tn.gov. And I actually put that email in our chat box so that you can send questions to us or a referral if you'd like to.
Well, I'll tell you this, I want to encourage people to find out more about this service, to access this service, because it is, I think, one of the very important ways, really helping people become more independent in a lot of ways, because when you have to go to an ER, it puts you in a great state of dependence on your staff to get you there, on, you know, people being there in the ER to provide the service. This is a way a person can take charge of their healthcare in a lot of ways. And so I highly encourage people to do that. I think we're in a state in this system that we're in where we're going to have to help people become more independent in this manner and work smarter rather than harder, as we've been doing all these years. So really appreciate, Carol, you being here today, Milton, you being here today to help us understand more about this service and how important it can be. Thank you so much for being here today.
Thank you for having me, Dr. Davis.
And thank you all for being here. This is the Clinical Consultation Network. We do this every Tuesday at 12:30. And if you're not joining us, you're missing out. This is your weekly opportunity to get your clinical boost so that you can get out there and really support people. So thank you all for being here. We'll see you next week when we'll have Dr. Uzama Price talking about diversity and inclusion as our guest. Thank you all for being here. We'll see you next week.
Thank you all so much. Bye now.